The global drug situation is getting more challenging. The United Nations Office on Drugs and Crime reported that 236 tons of methamphetamine were seized in East and Southeast Asia in 2024, a 24% jump from 2023. Drug use has also continued to rise globally. The World Drug Report 2025 reported that 6% of the world's population aged 15 to 64 used drugs in 2023. Singapore is vulnerable to these developments. Methamphetamine remains the most commonly abused drug in Singapore, reflecting the worldwide trend. Singapore's drug control strategy is anchored on tough laws and robust enforcement. We also invest in upstream preventive education and evidence-informed rehabilitation and reintegration programs for abusers. This approach has proven effective and kept the drug situation here under control. In 2025, CNB dismantled 25 drug syndicates and seized more than $21 million worth of drugs. Mr. Jackson Lam asked whether we are strengthening intelligence sharing and joint task force arrangements with ASEAN partners to disrupt drug supply further upstream. CNB shares intelligence and extends support to foreign drug enforcement agencies to disrupt syndicates that attempt to traffic drugs into Singapore or exploit Singaporeans as couriers. In 2025, CNB conducted 18 joint operations with our international partners. Mr. Alexio asked for an update on plans to address the rising trend of youth abusers and how we can effectively engage them on the dangers of drug abuse. In 2025, 3,208 drug abusers were arrested, a 1% increase from 2024. The number of young drug abusers is also on the rise. In 2025, about half of the new abusers arrested were below the age of 30. In the Health and Lifestyle Pulse Survey 2025 conducted by the Institute of Mental Health, or IMH, around 1% of Singapore respondents said that they had used a drug in the past 1 year. While this is lower than the 6% worldwide figure, we must continue to strengthen our preventive drug education efforts, or PDE, to combat drug abuse. The Inter-Ministry Committee on Drug Prevention for Youth started the Drug Victims Remembrance Day in 2024, reminding everyone that drug abuse is not victimless and its harms extend beyond the abusers. Last year, Remembrance Day focused on empowering young people as active participants and advocates against drugs. We garnered over 180,000 promises to stay drug-free. In schools, MOE supported CNB in developing age-appropriate materials for teachers to facilitate meaningful conversation about drug harms. Universities hosted spaces in their campus for reflection and dialogue about the harms of drugs. Planning for this year's Remembrance Day is underway. The observance event will showcase stories from Singapore and overseas on how drugs have harmed lives, families, and societies. We will involve the wider drug-free community and community partners in our efforts. Besides Remembrance Day, CNB conducts drug-free SG campaigns to sustain amplification of the drug-free message. The Uninfluenced campaign was introduced in 2025, focusing on empowering youths to remain uninfluenced as they encounter multiple narratives about drugs, including misleading information. Our first run featured an immersive theater-cum-escape room event to pique youths' interests and provoke thought on evolving drug issues in a relatable way. We received encouraging feedback with participants who look forward to the next event. Our outreach also garnered strong traction online. In 2026, we will extend the Uninfluenced campaign through both online and physical engagements with tertiary students. We will encourage them to reflect on the influences that shape their perception of drug abuse. Mr. Jackson Lam asked whether we should engage children before they enter secondary school. CMB partners with MOE to integrate PDE content into school curricula in educating students on the harms of drugs throughout their educational journey. For primary school, the focus is on general substance abuse and teaching impulse control skills. The Anti-Drug Ambassador Activity Program engages primary 4 and 5 students through activity booklets with engaging storylines and interactive activities. Our PDE efforts have shown encouraging outcomes. The 2025 National Drug Perception Survey found that attitudes towards drugs among youths have turned more conservative as more youths perceive that drug abuse is harmful. 87.7% held conservative views compared to 83.2% in 2023. Attitudes towards drugs amongst adults remain staunchly conservative at 90.2%. There is also strong support for Singapore's drug-related laws. 92.7% of the youth respondents and 96.3% of the adult respondents felt that we should continue to maintain our tough laws to keep drugs out of Singapore. We will be amending the Misuse of Drugs Act this year to enhance investigative and enforcement levers against drug-related activities. We will introduce a presumption clause for hair test results. This means that if a controlled drug is found in a person's hair, they will be presumed to have abused it. This gives CMB a stronger tool for enforcement, since hair tests can detect abuse over a longer period. Mr. Jackson Lam asked if we have studied whether digital recruitment, especially among youth, is driving earlier exposure and whether we are considering proactive digital countermeasures. The health and lifestyle surveys include questions on why respondents tried drugs for the first time. The most common reasons cited for initiating drug abuse are due to curiosity, the belief that drugs will help them with their problems, and peer influence. Nonetheless, CMB takes a proactive approach by actively monitoring messaging apps and taking action against those who use such platforms to facilitate drug trafficking activities. CMB also conducts operations on syndicates tapping on such platforms to sell drugs and work closely with ICA and courier companies to intercept drugs and drug-related paraphernalia sold online. Beyond education and enforcement, it is also important to rehabilitate drug abusers and support their reintegration into society. Last year, I spoke about the positive findings from the pilot under the Supervision 2.0 regime, where hair tests are used to monitor CMB supervisees. Given the pilot success, we fully implemented Supervision 2.0 in May 2025. This cuts down the reporting frequencies from twice a week or twice a month, depending on their risk profile, to once every 3 months. This reduction has allowed supervisees to go about their daily life with less disruption, helping them reintegrate better into society while allowing CMB to have effective oversight of their rehabilitation. We are also seeing encouraging results on the rehabilitation efforts of Singapore Prison Service, or SPS. The 2-year recidivism rate for the 2023 Drug Rehabilitation Centres release cohort decreased by 4.7 percentage points to 26.1% compared to the previous cohort. Desisting from drugs is challenging. We stay committed to supporting drug abusers in their rehabilitation journey through evidence-informed true care, drug rehabilitation, and robust supervision. Drug abusers undergo differentiated drug rehabilitation, where programming pathways are customized based on the assessed risk of reoffending and severity of drug abuse. For repeat drug abusers who are of higher risk and require more intensive programs, SPS has implemented a new psychology-based correctional program, PCPs, that focuses on personal reflections, emotional processing, and practical skills building. Mr. Jackson Lam asked whether gender-specific prevention and rehabilitation strategies are needed for women drug abusers. SPS adopts a gender-responsive trauma and trauma-informed approach for women inmates, including women drug abusers. SPS effective gender-specific programming for women inmates received international recognition when it was awarded the Reducing Reoffending Award from the International Corrections and Prisons Association last year. Mr. Abdul Muhaimin Abdul Malik asked how mental health data and integrated support services are utilized to reduce recidivism. SPS assesses all inmates admitted to prison and DRC on the state of their physical and mental health. SPS partners IMH to support the rehabilitation needs of inmates with mental health conditions and special needs, including referral for assessment to the prison psychiatrist from IMH. Inmates with complex needs are referred to a multidisciplinary team for appropriate intervention. To support their reintegration, SPS partners community agencies to ensure continued medical care and support after release. I will now touch on rehabilitation and reintegration efforts for inmates generally, which Mr. Patrick Tay, Gabriel Lam, Christopher D'Souza, and Ms. Cassandra Lee have filed cards on. The two-year recidivism rate for the overall population remained low and stable at 21.9% for the 2023 release cohort. This continues to be one of the lowest two-year recidivism rates internationally. The two-year rate is a proxy indicator of the effectiveness of in-prison programs and reintegration services available for ex-offenders immediately after release. The 5-year overall recidivism rate has increased by 2.7 percentage points to 39.3% for the 2020 release cohort. It is low by international norms. The 5-year rate is a measure of the sustainable ecosystem of community and family support for ex-offenders to prevent reoffending in the long term. This cannot be done by SPS or the government alone and requires strong community support to increase human, social, economic, and community capital of inmates, ex-offenders, and their families. SPS has set out in Corrections 2030 its comprehensive strategies to reduce reoffending in the longer term. This involves strengthening the families of inmates, maximizing the employability and career opportunities of inmates and ex-offenders, and mobilizing community partners to support rehabilitation and reintegration. We will monitor and track the initiatives rolled out under these strategies to measure its effectiveness and impact. The building of economic capital through education and skills training is important for successful rehabilitation and reintegration, enhancing inmates' ability to secure jobs after release. SPS and Yellow Ribbon Singapore, or YRSG, have continued to enhance their efforts in these areas. First, more inmates will benefit from workplace literacy and numeracy, or WPLN certification, which is a recognized qualification for employment and upskilling opportunities in Singapore. Second, there will be more skills training pathways. This includes a pilot partnership with Temasek Polytechnic to develop a program that introduces Skills Future Singapore accredited courses in communication and graphics and media and content creation for inmates. Third, career resource centers have been set up in prisons to allow pre-release inmates to assess career-related materials, prepare their resume, submit job applications, and attend career talks, empowering inmates to take ownership of their employment journey. This expands on the present framework of career retention support provided by YRSG. By enhancing inmates' readiness for employment, we encourage a personal commitment to positive change, leading to sustained reintegration. Successful reintegration also depends on employers' preparedness to hire ex-offenders. YRSG conducts structured onboarding sessions with new employers and monitors the effectiveness of our partnership with employers through regular engagement sessions. For example, Project Beyond Hiring trains and equips workplace supervisors with the skills needed to manage ex-offenders effectively. This complements YRSG's career retention support and better prepares employers to integrate ex-offenders into their workforce. Since 2024, YRSG has partnered with training academies to deliver 5 workplace coaching and mentoring workshops, training 71 supervisors from 23 partner employers. As at end 2025, there were more than 6,400 employers who support the hiring of ex-offenders. YRSG provided employment statistics to over 2,100 inmates, of which 94% secured jobs in 2025. Mr. Patrick Tay asked if the spend regime for criminal records could be reviewed to support ex-offenders. Our current assessment is that the regime remains appropriate and fair in striking a balance between rehabilitation and reintegration of ex-offenders and the interests of potential employers and society at large. Beyond enhancing inmates' economic capital, it is important to build their social capital through strengthening ties with the family and developing pro-social networks in the community. The family engagement model of FAME was launched to strengthen inmates' relationship with the family, to support longer-term desistance. As part of FAME, SPS developed the Together in Every Step. It's a program where every inmate will attend upon admission to identify their family needs and be matched with relevant programs and services. SPS will implement the peer engagement and empowered rehabilitation support framework to strengthen the existing community of pro-social inmates and desisters. Suitable inmates have been trained as peer supporters and will further develop their skills by co-facilitating motivational and psychological correctional programs with SPS staff. Upon release, these peer supporters can join the desister network community to further develop their skills in this area through participation in desister support groups and continuous learning. Initiatives under the Yellow Ribbon Project, or YRP, will be enhanced in 2026 to continue advancing community partnership and inspire community support for ex-offenders' rehabilitation and reintegration. YRP will revitalize its flagship events to attract new audiences. For example, the Yellow Ribbon Prison Run will hold its inaugural City Run in 2026. Participants will experience a scenic route around the National Stadium, culminating in a vibrant endpoint carnival that brings communities together to celebrate second chances. The YRP message will be amplified through strategic partnership with well-established brands and organizations that share our vision for an inclusive society. Our community partners are key in inmates' rehabilitation and reintegration journey. SPS continues to increase its engagement with community partners to equip them to better support inmates after their release through structured and tiered training. Under the Igniting and Maximizing Partners Agility for Correctional Transformation program, SPS provided 2,200 training spaces in 2025 for volunteers. In 2026, the number of training spaces will be increased to 4,500. I will now speak in Malay on the role of the Malay Muslim Organisation, or MMOs, in our rehabilitation efforts. MHA bekerjasama rapat dengan pelbagai badan-badan Melayu Islam ataupun India Islam ataupun digelar MMO dalam usaha pemulihan dan integrasi semula para pesalah dan bekas banduan. Ini kerana MMO lebih peka terhadap nuansa budaya masyarakat kita. Pada tahun 2024, kumpulan projek Next Lab dibentuk di bawah rangkaian pemulihan MMO atau MMORN untuk mendapatkan pemahaman yang lebih mendalam tentang keperluan keluarga, para pesalah dan belia berisiko. Kumpulan projek ini menyatukan MHA dan badan-badan MMO untuk mengenal pasti jurang dan mencadangkan saranan-saranan untuk mengukuhkan sokongan. Kerja kumpulan projek ini masih dalam proses dan kami menjangkakan untuk mengumumkan set saranan yang lengkap semasa forum MMORN yang akan diadakan pada lewat tahun ini. Sebahagian daripada saranan awal mereka termasuk talian hotline dan dikhususkan untuk keluarga-keluarga pesalah dan bekas banduan dan juga sebuah hub rehabilitasi untuk menyatu padukan program dan inisiatif MMO di bawah satu bumbung. Sir, MHA has enhanced the culture responsive rehabilitation for the Indian offender population. SPS collaborates with SINDA to provide assistance to Indian inmates and their families. SPS has also collaborated with Fitra and Abdul Ghafur Mosque to provide faith-based mentorship for Indian Muslim inmates. SPS efforts to engage and build more partnership with Indian organizations is guided by SMS Murali. This will help to enhance the rehabilitation and reintegration of Indian offenders. Sir, in conclusion, I thank all members of this House for your support for drug control efforts and for fight for drug-free Singapore. We will continue to achieve even better rehabilitation and reintegration outcomes and reduce reoffending. But to succeed, we need everyone's support across society to give second chances to our ex-offenders.